Welcome everyone. Thank you for joining us here for the Primescan and Panthera roundtable discussion. Today we're going to be focusing on digital technology and treating patients for sleep apnea. I'm joined by Aditi Desai, Riaz Yar. We're also joined by Béatrice from Panthera Dental. So without further ado, if everybody could just give themselves maybe a quick introduction. We'll start with Aditi.
Thank you, Jack. I'm Aditi Desai. I'm president of the British Society and Academy of Dental Sleep Medicine and incoming president of the dental section of the Royal Society of Medicine. I'm a dentist by profession, and I limit my practice to the management of patients with sleep disordered breathing, TMD, orofacial pain, and sleep bruxism.
Excellent. Thank you very much, Riaz.
Thank you, Jack. I'm Riaz Yar. I'm a specialist postodontist. I'm based in Manchester, and I've introduced the digital sleep workflow into my practice. I'm on the early part of that journey, but it's exciting, and happy to share that today.
Thank you very much, Riaz. Béatrice.
Hi, my name is Béatrice Robichaud. I'm from Quebec City, Canada. So here's the accent. I'm the co-founder of Panthera Dental, a business located in Quebec City that specializes in production of dental product, mostly sleep apnea solution.
Thank you very much.
You're welcome.
Thank you for those introductions. In this session, we have done several sessions specifically looking at sleep apnea with Panthera. In this session, we are going to keep the conversation very much focused on the clinical outcomes, patient care aspect, as well as treatment acceptance. So that's going to be the themes for our discussion today, alongside obviously digital technology. So I'd like to start the conversation with a bit of an open question. What are the clinical benefits you feel of using digital solutions and technology for treating patients with sleep apnea? Why is it an advantage? What are the benefits over a traditional, let's say, normal impression workflow? Who would like to?
Okay, I'll try and break it down into sort of simple boxes for everyone. So the way I see it, the benefits are from a dentist perspective. So the dentist perspective is not having to prepare the impression tray, he's not having to stock impression material, he's not having to worry about cross-infection of that impression material. He's not even worried about having to, tray, for example, try the tray size in, put the adhesive on correctly, take the tray out correctly. Then you've got the patient experience of having to have their, a mouthful of gunk in their mouth and tolerate that for 30 seconds or longer if you're taking a silicone impression and you're having to send it abroad. So dentist perspective, I think career enhancement, definitely. Business perspective, you're cutting your work time down by half. So impression time, if you're setting 15 minutes for impression time, for example, you can easily cut that down to 7 minutes because it is so quick. And then the patient benefit from that, they love not having anything in their mouth, and then you're not having to take an impression, and they love that experience of, oh, you've just done an impression. So there's sort of benefits for the dentist, there's benefits for the patients, and then you have benefits for the team because they're not having to worry about sending that impression to postage. It gets lost in the postal service, and then you're having to get the patient back in, and you've lost that record forever. So multiple benefits. Then you've got the workflow. So you've got the Connect software. So you can scan the patient, do your bite, and then it's emailed to Panthera's inbox. Within 30 seconds, it's in their inbox. And it's easier for the team. You just literally have a box. We have a box on our sheet, and it just says, digital impression sent to Panthera. So then that's logged within the team, so they know it's a digital impression. It's just so much cleaner. No cross-infection issues. And the workflow is seamless. And then all you're waiting for is your box of goodies to come from Panthera. And I love the box of goodies. I'm just excited opening it as the patient.
Yeah. Just moving, adding to a little bit of what you've said, which is absolutely perfect. For me, I think while you're looking at treating patients with sleep disorders, it improves their quality of life. but heck, does it improve the quality of my life? It really makes things so much simpler. You know, we were talking about the nurses having to disinfect, post, but what about the material deterioration during transportation? That is a really important aspect for when you're working with high-end dental devices. I think that's a very important aspect of things.
Excellent.
And you know, that and in the current time where we're all very much on high alert with COVID, the fact that you know you can say to a patient, I don't take impressions anymore because I don't want to have any, I don't have to touch things and just use a scanner. It really, you know, it gives them that extra bit of confidence in yourself because they feel that you're taking everything a bit more seriously than you would have done otherwise.
Definitely.
Yeah, and the Primescan.
There's something there's something I want to add also more on the personal aspect as myself being a patient also. I realized talking with a lot of a doctor and also with some patient that a lot of time, remember, you have two kind of patient that come in a dental clinic. One of the first obviously is a patient that have difficulty to wear their CPAP machine. We're probably going to talk more about that. But remember that they used to have a solution that fell on them. So they're really worried about the next solution is they're going to work. So seeing that we use the top technology out there, it's increased their trust on the Plan B treatment. And we start with patients that already have, you know, lost faith in solution right now. So it's something that really increased. And secondly, because that's his personally, I'm a very high allergic person. And right now I'm right into my allergy. And when you were talking about the regular impression material, this 1 minute you're talking about was probably one of my minute I remember most as being really difficult for me. It took all my, you know, my willpower to be able just to breathe that versus scanning impression. And remember, we're talking about people that have breathing problem. So just on that, as a patient point of view, it's really a game changer. It's feel more confident. It's easier for me to accept that I have to go through this step that is a necessary step to get my treatment versus an impression. And believe me, I am one of the patients that really push forward my appointment if there's a regular impression involved. Do they expect that? I remember having some other dental. I wanted some Broxis and white whitening solution. I pushed it for 3 years because my doctor didn't have an intraoral scanner because I don't want an impression. And I'm sure I'm not the only patient like that. So digital impression is a game changer for the quality of experience as a patient. And I love that.
Yeah, you know, it's allowed me to treat a lot more patients actually, because where patients can't tolerate impressions like you said, and they're gaggers, for example, you know, you have the scanning and it just completely changes their perspective, and you can then train them to accept an oral device, but they can understand that having something in their mouth which is not so bulky and gooey, I think it's quite good for them.
It's a big thing, isn't it? Especially when you can stop and start a scan at any time. If you have got a patient, I'm sure you've had patients that have gagged in the past, even with an intraoral scanner, if they've got a really high, you know, low tolerance on their gag reflex. Just being able to stop a scan, allow the patient to calm down, start again, it's just something you can't do with normal impression.
And you can show them. I mean, you know, you've got the screen there, and the amount of times patients go, is that my teeth?
Yes.
Oh,
really? Is that me? Have you just taken an impression? I mean, you always have the odd patient. The very odd patient will say, oh my God, what are you doing to me? Are you radiating me? Yes, you know, but you know, it's, and I have had people who said, you know, I've got tinnitus now because you've been scanning. I'm saying, no, that was just the sound. I can play Bach if you want. It doesn't matter.
Yeah.
But I think, you know, making the patient aware how the scanner works, you know, through optical imaging, I think it's a real game changer, like you said.
Patients
it's fantastic.
now, they want to share this. You know, we've got patients who pull out their phone, and they'll sort of record the screen, and it's on their family WhatsApp group and so on. So you know, the digital technology really, for me, it's, you know, I feel it's a sad reality that, you know, in the UK, I think we're about 6-7% of dental, you know, dentists have an intraoral device, and that really has to change. Because once they've had it, I can 99.9% guarantee that they'll never go back.
You know, since COVID, there's been such a rush for intraoral scanners that the scanner companies have not been able to keep up with the demand. And it's all because they've recognized the importance of as little human touch as possible.
Yeah.
And that is great.
Yeah, I agree. And you know, specifically with sleep workflows, for anyone that's not familiar, because we may have, you know, many people watching that have never actually really treated patients for sleep. If they were to invest in a scanner as part of a way to enable them to do it, I think, Riaz, you would probably be great at answering this question, because, you know, you've done some cases yourself. What does, you know, put it in simple words, what does the workflow look like from start to finish for you to treat a patient for sleep apnea with a scanner?
I think before you sort of obviously start the digital workflow, you will need some form of training.
Yeah.
So it's understanding that. So as long as the proviso is that you have, and that's also following nice guidelines. You know, as long as you've got some form of training, and Aditi and I are looking at formal training for people. Once you have that, the digital workflow is seamless and very quick. So you are doing an upper and lower scan. You're doing a bite and a protrusive bite, and then you are uploading that to the Connect software, and 30 seconds later it's in Panthera's inbox.
Yeah.
Now, I trust, you know, I've got a Panthera device and I actually really like it. I love the feel of it and the solidity of it. It's an unusual feeling, because, you know, it's sort of, when you think nylon, you think it would be maybe a little bit softer, because we, you know, as dentists, we think Valplast, Valplast dentures, which are the flexible dentures. But actually this is not like that at all.
No.
The quality is very apparent, and I've been wearing it as well. And this topic is close to me anyway, because I suffer from it, so it's something that is close to me. So I'm giving a personal experience going, oh wow, okay, this is how this device feels. And I've tried other devices to be able to then sort of compare, and what, you know, psychologically it feels when I put it in the mouth. And the quality with the Panthera device is very clear. You know, it's solid. But the workflow is quick. So it's an additional income stream, but it's also, you know, for the patients, it's something that they see. They come in 15 minutes and they are done. And then, you know, you've got your fit appointment, you know, 2 weeks later to fit the appliance, and Aditi will vouch for the fit of the appliance with digital scanning. We're not adjusting. It literally just click, and it's
amazing.
It's done.
And for you, Beatrice, then, so, you know, obviously Primescan, high quality scanner, Panthera appliances, high quality appliances. Why is it important for practice to be using scanners of high quality like Primescan? What does it have an impact on the final outcome for you?
It does have a major impact on the final product, as said. Obviously, we've been producing this type of appliance for years now, and scanner are continually improving. And what we've seen as a shift change is by using the latest technologies such as Primescan, and also following the correct workflow provided by Primescan, is that exactly the first try when we put the appliance in mouth require no adjustment. And I'm going to be honest, the first year when we started with more regular impression, we had more doctor I'd say, well, you know, not a lot. I have but maybe put 5-10 minutes to do some minor adjustment. But once we started to see doctor using highest technology, and when Primescan, obviously recently with the big launch of Primescan all around the world, in US, we have a huge database of doctor using Primescan, and all of them are confirming what we were expecting. The first try-in is the good one. There's no more adjustment needed, and that's just surprising. And obviously there is explanation behind that, using the technology of the Primescan, and why the Primescan is getting better than some other technology out there, because of the camera, the precision that is out there in the camera. And also there's a lot to go also with the easy handle of the scanner versus some other scanner that you have to do tricky, let's say, scanning pathway to be able to have a precise scan, versus the Primescan is really easy to handle on the first try. And that is really make a big game changer in the fact that right now, as said, there's a lot of patients that need to be treated worldwide, so we don't have time to adjust. And one of the problem with adjusting an appliance is that, and Aditi can confirm that, is sleep apnea is a lifelong treatment. And appliance, as good as they are, and mine is really good on that, they're going to need to be changed at some point. I mean, it's like a pair of glasses. I mean, if you take care of your pair of glasses, you might keep them for 10 years, but a lot of people after 5, 6 years will change them. You know, appliance will be the same. If you take care of them, yes, they can hold for a good 10 years, but you know, they might change a little color. You might want to have a brand new one for many reasons, or you might just break it or lost it or something like that. Imagine if you have to put a half an hour to adjust it on the first time. You don't remember what you did. So on the second time, you're still gonna have to do, I'm sorry, you're still gonna have to readjust the appliance. And that's not what digital is supposed to give you. It's supposed to be exactly a perfect copy. So 5 years later, you don't even have to scan your patient again. You just say, reprint a new one. Your patient come, you put it in mouth, and you look at your patient, say, well, I did book, you know, an hour for my appointment. You say, well, I'm sorry, Mr. Patient, 15 minutes was enough for me to put you your second appliance. It's exactly the same product. You're exactly the same person. So there you go. And then you continue the treatment. And that's what technology and precision bring us.
And, you know, obviously Panthera, experts in sleep appliances, what personally do you find the acceptance rates for patients? You know, patients having this type of appliance made, you know, how does it compare to other forms of treating sleep apnea? Is it massively increased?
Yes. So what is interesting, there's a lot of study that are ongoing like on that topic. But what's interesting is that at first we know that CPAP unfortunately have a compliance rate that goes around 50% in average. Okay. Now with oral appliance, we've seen this number increase to 70, then 80, and now it's even 90, 95 and over. What I've made the shift is exactly that we brought precision. We have reduced the size of appliance by using newest technology material, as digital are bringing us with 3D printing as an example. We make them more comfortable, as said a few minutes ago. So compliance is increasing. And something that science is showing us more and more is that if patients wear their appliance all night long, every night of the week, their efficacy on their quality on life, on the comorbidity, on their and obviously on their apnea treatment is incredibly better than obviously having a CPAP that you wear only a few hours per night. So it's really remarkable what technology is bringing us by mixing technology as precise as a scanner and also as a manufacturing, all digital manufacturing. And very, very important to understand here, it's one is independent of the other. I mean, there's something that's a garbage in, garbage out. And that is true. If the initial impression is not as good, even if I got the best technology to fabricate, I'm still going to be at the top of what you provided me.
Excellent.
Can I sort of say that when you're looking at analog impressions, so the operator takes the analog impressions, send them off to the lab. The impressions may look okay, so the device is made. With digital technology, with the scanning, usually if there's any problem with the stitching of the images, the technician will always pick it up and immediately they'll let you know. So the fabrication of a device that doesn't fit is almost zero. Where with analog, you don't know if there has been a problem because they wouldn't know that the impression is warped or not.
It's not obvious. Too many variables.
Yeah, too many variables, like you said. Yeah, absolutely. And you know, the patient outcome, we only get one shot at this. The patient experience. You know, when they have a device where they see that the way that the whole process works, you know, the workflow, and then the device goes click, click, a precision device, and they have a really positive experience. They're likely to keep coming back to the same operator or seek out the same type of device. Whereas if you have something that's being made to fit rather than fit immediately, you know, having to adjust it again and again to make it fit, I think the patient experience is not so great. And I think that their perception of, you know, the treatment is always going to diminish.
Yeah. I think what's interesting as well is sort of following on from that is the choice of appliances that you have as well.
Yes.
You know, the DSAT Classic and the DSAT X3. You know, I've tried both, and you know, I like the X3. It's just a funny sensation of that freedom.
You cannot have bias.
I know your bias is yourself, sort of, you know, but it's having that flexibility, you know, so saying, okay, well, we'll try this, but there's also this, and you don't have to take another impression.
Yeah.
So you've got, you know, you can literally from that one impression try different appliances. It's sort of comforting and reassuring, because, you know, patient feedback is, the outcome is also, you know, is the patient feedback. And then wearing the device and, you know, feeling comfortable with it.
So what would be your recommendations then for, you know, let's say we've got a dentist or a dental practice that is looking at getting into sleep workflows. Ideally, from what we're discussing here, it seems like digital is definitely the way to do that. I don't think that's any question. But what would be your recommendation? How does someone who's not really involved in this, where do they start? What do they do?
Training.
Well, training,
Education, training, ongoing education. That is absolutely mandatory. And sorry, Riaz, you can, you know, I mean, and that has now been highlighted even in the NICE guidelines. I know they're just guidelines, but I think that from that guideline we'll have some, you know, some kind of position statement that'll be published soon in the respect that, you know, if you want to do this, you must get the appropriate training. If you then want to be indemnified. So the training is something that we need to focus on.
Absolutely. And then you have the scanner.
There's one thing I want to add. There's one thing I want to add. Make one for yourself as a doctor, and make one for one of your trustable employee, could be your assistant hygienist or your other colleague, before you even start talking that to your patient or going in training, in the fact that feel what technology bring you. Even if you're not a snoring or sleep apnea patient, wear it one night, wear it a couple of nights, and feel that. And I think that's important to understand exactly the benefit of this, because as a dentist, you already know what is a Broxis appliance or a prosthesis, and you know the feeling of wearing them. And then trying this kind of appliance will teach you a lot first to understand, okay, this is what I'm going to ask my patient to wear to treat them, and then get the proper training, as Aditi is saying right now. And then you're obviously get a good scanner, a prime scan, and then you're ready to go. And that's what is interesting.
How can you possibly ever recommend anything to anyone, be it a patient or an employee, anyone, unless you've tried it yourself?
I think the more...
Yeah, well, it's a little hard to try dental implant if you don't need one, but I obviously...
Talk about the sleep aspect.
but I think that's a fair point. You know, what Béatrice said was that I think a dentist who's had more experience of dentistry themselves, sitting in the chair and having even a filling or a crown,
absolutely,
makes them more empathetic to their patients. And that's what, you know, I think that's what Béatrice is getting at. You know, if they get to wear an appliance, they're more empathetic with their patients when they're asking them to wear an appliance.
Absolutely.
But, you know, digital sleep workflow is for me, is a later step in your digital workflow.
Yeah.
You need to have a scanner that can do restorative, and I think you need a scanner that can do all of the things. That's the key thing.
Yes.
And digital workflow is just a fantastic, you know, to your, you know, an additional bolt on to what you do, you know, in all your clinical work.
Excellent.
I agree. But the training aspect is probably the most important.
Absolutely. In digital sleep workflow, in sleep workflow, yes.
Training.
In sleep medicine, you're going to have the knowledge to be able to assess and screen these patients properly.
Because this is a medical condition, as I've said previously. This is a medical condition, and you need the training to be able to kickstart the whole process.
Yeah, absolutely.
Absolutely. Anything from your
And
side,
I think
Béatrice?
there's something also that I want to add that is important is, as we remember, and this is not, it's not a fight, it's not a battle, but this is a reality also, is that we, when you treat sleep apnea, you're talking, and we're going to have to work with a physician, sleep physician, pneumologist, or any other specialist, cardio. And then the thing is that when they heard about sleep appliance that was handcrafted by a guy in his basement, it's normal that they have a kind of a doubt about the quality of the appliance, even if they were good. And then we know that they were very good appliance many years ago, they were working fine. But what I'm seeing is that what is great is that when you come with an appliance that is used digital impression, that is digital fabricated by 3D printing technology, you also increase the trust within the medical field with the physician that what we're offering is a standardized and custom-made solution comparable with a CPAP machine that is mass-produced in high-tech production facility, also respecting, you know, medical manufacturing norm and ISO regulatory and etc. And that is also a key point. By using this kind of technology, we're creating this word of mouth within the patient and the medical association and industry that we have reached the same level. And well, I'm going to preach for my own, but even say that at some point surpass what the CPAP has to offer in regard of compliance. And that is really impressive when you think about it. Because one thing for sure, and that I have to give that to the CPAP machine, is that when the doctors say, okay, you're going to need a CPAP, to send them to a CPAP manufacturer, it doesn't matter. It can be this brand or other brand. All CPAP will work fine, okay, as treating the patient. But it's rare that with appliance we could say that until now, with the mix of intraoral scanning and digital manufacturing. And that is a game changer in the industry.
But Beatrice, you were talking about, you know, the physicians having trust. Now, if you remember, there's a publication by Bernard Fleury and Alan Lowe from Canada in the Journal of Dental Sleep Medicine about why there are barriers to the prescription of these devices. The thing is, you know, one of the barriers is that they're worried about the side effects and complications. There's absolutely no mention of any barriers or on the prescription of CPAP, but that's besides the point. We're not talking about CPAP. But the oral appliances, yes, of course, there were complications of, you know, occlusal changes, perhaps, you know, pain. But now, but they were compared to the not precision devices in most part. But if you look at the precision devices that we're talking about, I think that mitigates and minimizes the risk of those. I will never say it's a never event. I'll never say it never happens, but I think it certainly minimizes the risk. And that in itself, yeah.
As a matter of fact, Aditi, I will confirm that, because exactly the Primescan, what I want to give the Primescan among all the other technology out there is the precision of the bite scanning. Because the Primescan, I've developed, the engineer behind the scanner, I've developed a specific protocol by scanning both sides that will give us one of the most accurate bite I've seen. And one of the side effects of many appliances, it's a bite shift change by wearing an appliance that's not well adjusted. I have a very good doctor that told me nobody died from a wrong bite occlusion. They're right about that. Things said, obviously, it's a side effect that we try to avoid. So by having a most accurate bite scan, it will reduce the factor change of having exactly a bite shift change. And as you said, reduce the barrier of having side effect. As surprising it is, and Aditi, you know that there's a study that show that CPAP have also bite change and then occlusion change and so on, but they're not really talked about. But no, exactly. But yes, exactly. And that's a key factor of what I love about the Primescan. Once we discovered that, as a matter of fact, it's really surprising. We were talking with a local representative of Dentsply when they trained us on the Primescan first time. We were using a bite scanning technique from what we know from other brand. And then she corrected us. She says, no, that's not how you use a Primescan. You do it that way. It was really simple. And then it has to put all my team in doubt. So we took back all the other technology and we made an internal comparative of bite, and the Primescan was amazing. And we were talking about first time adjustment. This is where we hit most, where doctor told us with Primescan where they were doing the most adjustment was on the occlusion. They were just saying, you know, it's just a little too tight or a little too, the bite was a little too predominant. Yeah, so they just say, you know, I just put my drill 1 second and problem solved. Now we remove that part with the proper bite. It's right on first try, working perfectly fine.
Fantastic.
Thank you very much. And thank you everyone for all of your insights. I think it's been very clear that there is definitely an advantage in treating patients for sleep apnea, specifically with digital technologies, utilising appliances like Panthera. With that, please don't let this be the end of the conversation. Please join us in the networking lounge for more of these discussions. Thank you.